That the House Energy and Commerce Health Subcommittee with oversight of the CDC is holding a hearing this coming Thursday. And joining me now from Nashville is Congresswoman Marsha Blackburn, Republican of Tennessee, who sits on that committee and who recently visited the CDC. So Congresswoman, thanks for taking a few minutes this morning. And let me just start by asking your reaction to the news overnight and to what you heard at that press conference just a few minutes ago.
Well, it's so disappointing to know that there is another infection, and of course we're all concerned about the victims and those that are infected by this virus. You know, Steve, we've had 8,000 individuals infected. There have been 4,000 deaths, and the projections by the CDC are a cause of concern. But we do know that the protocols are now in place, and they will be tracking this very closely, as you've just heard.
Yeah, I mean, I was saying to our panel here just a minute ago, it seemed reassuring to me listening to the description of how this patient ended up in isolation. He or she had been taking their temperature twice a day. The minute it reached that threshold, went straight to the hospital, was brought right in the isolation area. They said the whole thing took about 90 minutes. So I know there have been a lot of questions about this particular hospital and in the handling of the first patient, but it certainly seems like maybe they've gotten their act together.
Well, and when I was touring the BSL-4 lab, which is where they do the research on the pathogens and on Ebola, and then my subsequent conversation with Dr. Frieden and Dr. Merlin this week, I said, tell me how we're handling all of these fluids from the patient in Dallas, because they do not have that BSL-4 level lab and have the credentialing around that lab. So I think what you're going to see are some additional protocols, as there are different hospitals around the country that will have patients present who are concerned that they have Ebola. I also know that there's another aid worker. We're hearing another aid worker in Liberia that has an infection, and that they are quarantining or surveilling about 20 military and 41 other aid workers as they work through this situation. Their goal is to reduce the spread of infection, and of course we've got to take every step necessary, whether it is in the affected regions or here, to make certain that there is a containment and that you do not see us hitting 1 million cases, as has been the projection if it stays on this trajectory. And whether it's a travel ban or whether it's expanding some of the surveillance, the quarantining before people are allowed to come into these countries, we need all of those options on the table right now.
So let me ask you about the travel ban one. I know there was a poll taken this week. This was an NBC News poll that showed there was strong support for this idea of the travel ban. I think it came in at about 58%. And I know you visited with the CDC, but the head of the CDC himself has said two things. He said not only is the idea of the travel ban not necessary, he said, this is the head of the CDC, it would actually be counterproductive. He said, and his argument is basically, look, right now, this is something, there are now 2 cases in the United States, but this is something that's exploding in West Africa. We have a chance, he says, with aid workers, with scientists, with medical personnel, to go in and contain it in West Africa to make sure it doesn't spread anywhere else out of there. We have the chance to do that, and the travel ban would interfere with that. Does that not persuade you when the head of the CDC says that?
No, it does not, and here is why. Number one, they are counting on people to self-report and be truthful before they get on those planes. Now, this is one of the things that happened in the Duncan case. He was not truthful in his self-reporting. So if you were to establish a quarantine there in this affected region and have people quarantined for a period of days before they could activate their visa to come, and then a monitoring as they come into the country, I do think that would be helpful. These are options we need to be discussing and looking at these right now. Having that quarantine before they get on that airplane, if we're not going to stop those.
All right, my thanks to Congresswoman Marsha Blackburn, Republican of Tennessee. Appreciate the time this morning.
Good to be with you. Thank you.
Sure. And as we say, it's obviously been a very busy morning, and we will keep you updated on the latest on this Ebola story as it develops. But right